Hey guys, Jason here. Today I've got a video for lower back pain. So all the videos we've done through MMT, I had a look back. I don't think I've done a lower back video, so today I've got one for you. So today I'm going to tailor it a bit towards if you're getting sciatica pain down the leg that might be related to your lower back. So if you have a look at this chart here, you can see there's different colours coming down the leg. Hopefully you can see that on the camera, Ninja.
Yep.
So what that is that relates to different spinous nerve roots. So if you're getting a sciatic pain down the outside of the calf here, you can see that it typically might be coming more from your L5 area. So this, I sort of look at this when I get someone that has sciatica. It's not an exact, but it gives me an idea of where that pain might be coming from and where it might be referring to. So if you're getting pain around into the quad, it could be coming more from L3. So that's just something to think about. If you are getting pain down the leg, you can look up dermatomes and that might give you an idea of where you need to work if you've got a spiky ball or something you're trying to release yourself at home. But I'm going to show you how we fix that using our thumbs and elbows. Alright, so I've got darts on the table here. Typically has a little bit of back pain, don't you?
Yeah, I'm always a bit tight through my back.
Alright, so we're going to start in typical money spot, so right in where the spine comes in and meets the pelvis, so right in here. So we're not starting up here, we're not starting on the glute, so right in where those erectors attach. And I'm angling sort of down under, if you can imagine. So the iliac crest is coming around here, I'm angling in under there. So sink in, and then we're going to slowly move around. So it's a firm but broad stroke to start with. So it's no fluffy strokes here, we're not oiling you up. It's not a really fast movement. And just little wiggles there if I need to just feel different areas, different angles. So normally I'll do what I normally do, so I might just do one warm-up stroke there, and then once I've felt where I feel the blockages, we're going straight in with the destroyer, the elbow. Alright, so finding where the spine is there, sink in to that money spot. Oh yeah. Going down. Oh. So I'm going down initially, and then I can start to angle my pressure back on a 45, or I can angle straight down to the same glute, but to start with I'm going to angle back in that way, so pretty much over towards his opposite glute.
Yep.
And this spot here is a typical spot that can refer a lot of pain down the leg, so if you are getting that sciatica pain down the leg, a lot of clients that I see that have that, this spot here will light up down the leg and it'll go to all different spots. You might get it round into the quad, down the hamstring, into the calf, into the groin, into the glute. This is normally a really good spot for eliminating a lot of that referral pain. So just sinking in, and then once he's adapted to the pressure, we can start to sink in that bit further. So we're not going too quick, I'm going with what the patient allows me to go in at, and going with what I feel the tissue's allowing me to go at. So if he's really fighting me here, I wouldn't sink in anymore. I'd just wait until I feel like he's sort of relaxed into it, get him to take a couple of deep breaths, and then I can go a bit further, or I might just simply change an angle and just angle a bit more that way. So you can see there, hopefully Ninja, I just change my angle that way,
Yeah.
or just by swiveling my elbow, now I'm angling a bit more straight down. I can pull back towards myself.
Oh, yep. Oh.
And you can see there, I haven't actually moved.
Yeah.
And it's been probably, I don't have my watch on, so that doesn't really work. You can see the watch tan, for those that love my singlet tan. I've got a nice watch tan going here at the moment.
You do tan, mate, don't you?
Sure, I'll get some comments about that one.
Oh, shit. That's bloody good.
But there you go, I do get out in the sun.
Yeah.
Don't worry.
Oh.
So yeah, this is like a typical treatment. I haven't moved here, it's probably been 5 minutes, Ninja, is it? A couple of minutes on the video.
Yeah, 4.5, yep.
Yeah, without actually moving, but I've changed angles and I've hit different spots,
Yeah, for
but
sure.
in that same area.
It feels like you've moved, man, but yeah, if you haven't, then that's it. Whew.
And so this is what a typical treatment would be. We're not moving really fast, we're just changing angles and I only move once I feel like that spot's come down.
Shit, yeah.
I can shuffle my body weight up this way if I want to drop into it a bit more, push pressure more down. But for Das, I reckon it's more back in on that 45,
Yeah.
so I'm going to lean over, get the old hand here and push back in. Any referral pain there, Das?
Yeah, it's just sort of spreading from that point down and around into the hip, or it just keeps changing with every little angle you move. But it's all really good.
And that's good feedback there. So yeah, constantly asking if that's replicating their nerve pain, if that's what they're getting.
Yeah. Yeah, you're right on the spot. It's really good.
And now I'm going to slowly start, so that I feel like that spot's eased up. I'm going to slowly start wiggling my way around, tracing that iliac crest. Staying on top of it though. Keeping that same pressure the whole way around. So I'm not lifting up when I feel like there's a spot coming up. We're not going away from it. Pushing through that pain. So if the person on the table flinches, I don't immediately lift up. I'll stay in that. I might ease up a little bit if they're really struggling, but we don't lift up and go around it. We want to actually go through that because that's the area that's causing you a grief.
Yeah.
Or you can broaden your pressure.
Broaden my pressure.
Yeah, so you don't flick, things like that.
That's right. So if I feel something coming up, I might just drop my angle of my elbow down, so now it's a flatter pressure and I can sort of move around it a bit easier.
Yeah.
But for Das, I'm going to keep it pointy
It's
and
good.
keep some pressure in there.
Yeah, I love it. Far out. Jeez, that's good.
Keep tracing around.
Yeah, coming up.
Yeah, it's coming up. There's a second money spot that's a bit further around, so it's just the outside of that erector where your QL comes down and attaches around there as well. So that's more the second money spot. So if the first spot isn't the spot, then typically the next one will be out here.
Oh, shit. That's freaking good.
There's another good one. Drop in again. Relax your head down there, Das. Good. A few deep breaths. Still going. Keep forming those little wiggles.
Yeah, that's freaking awesome.
Trace all the way around. And then I'll start to slowly sink out. Alright, and if that hasn't fixed you already, then we're gonna, if you've got a lot of compression in your spine, then we're gonna do a stroke up the spine. So I'll start off with a bit of a palm. So again, we're gonna sink on that money spot. This time starting a bit more on the SI joint, so that we can pick up the slack in the fascia, and then we're gonna slide over into that money spot, and then tracing up. So staying, I'm not on the spinous process here, but I'm just beside it in that laminar groove in the spine. So on the inside of, you can see on Das here, you see his erectors, so I'm just on the inside there. You can see where I'm putting my finger, that's where I'm going the whole way up. See, if you're someone that look in the mirror and you've got a really big tilt in your pelvis and you look like your back's really short and compressed, then this stroke here will really help to lengthen out this tissue. So I can even get a bit of a here and help to add into that fascial stretch to start with. Oh shit, yeah. There's another point up here where a lot of people tend to hinge from is the lower thoracic, where it starts to come into the lumbar. So a lot of people tend to overextend through that area, so they might be really stuck in that point. Sink out there and upgrade into the bigger tool again. Ooh. So again, this is the way I can hit money spot from a different angle. So I can come using the opposite elbow, sink down, and then I'm in that laminar groove, but I'm also in the muddy spot again. And this way we're going to clear it up.
Oh, shit.
Flatten out if he's really struggling, or I can sharpen it and start to move up. So not using too much wax. There's a bit of friction in here. Sometimes you get a little bit of a Chinese burn sensation.
That's alright. Feels good.
But that's also targeting the fascia.
Oh.
Slowly coming up.
Yeah. Ooh. Oh yeah, there's something there.
Yeah, so you can feel it coming up. We're nearly getting to that point where that junction is I talked about before, that lower thoracic, upper lumbar.
Oh.
So then we can slow it down even more. Sit there, angle. I might even pivot my elbow around so this way I can start to do a bit of a scoop. So now my elbow's flush there. I can sink down a bit more. Turn my body weight around, so I'm going down, and then I can angle back in towards that spinous process.
Oh yeah, that's money.
Yeah, that's money.
That
The
is.
dust might have a bit of compression in this area.
Yeah, for sure.
Keep that in, and then start to lean away.
Oh yeah. Oh, that's in the quad.
There it is.
That's in the hip flexor.
And that's up around that L3 that I was talking about before on the chart.
Yeah. Oh.
And then once I'm happy that's cleared up, we can start to pivot back around and move on through. So after dark, there is a little bit there, so I'll sit there for a little bit longer.
Oh, shit, yeah.
Take a few deep breaths. Get him to try and breathe and expand the back of his ribs. Breathe into that pressure. Nice, slow, but full exhale. Keep pushing all that air out, all the air out. See if you're really struggling, just trying to focus on your breath, or get them talking to me to try and distract, I guess, and get them to, take their thought off the pain. So we can keep tracing up. So we've got past that point now. Still a bit coming up in the thoracic. Knees up there. Alright, so we'll come around, I'll show you one more point. So I'll probably steal a ninja out of the video on this, but I might jump in and do it a little bit. So there's another spot under here, which is your quadratus lumborum or QL muscle. So it attaches onto the spine and comes just under the ribs there, and then runs down this way. So it's in quite deep. So I've got to come around, tracing the ribs. Then we're going to sink under the erector spinae, angling in towards the spine. So I'm in that little nook there. Hopefully you can see that. So this is the bottom rib here. I'm sinking in, pushing in towards that transverse process. You can feel Das is pretty jacked up in there. This is going to be a pretty tender area. Can refer a lot of pain down from here as well. If someone's not up to thumb, I might do a warm-up stroke through there with the knuckles, but for Das, I just wanted to show you what we can do. Get into it. Good, that's it, Das. I'll let you relax that arm down there. Good. Try and take a couple of deep breaths and expand the ribs out here. Push this rib out in my hand. Yeah, that's it. Slowly tracing down. So this way we'll come back down and we'll nearly hit that second muddy spot once I hit the bottom of this stroke. Staying connected. Sick out. Alright, so there's just a quick snapshot of a lower back treatment that if you come in and see us, we'll help you out. So if you're getting any of that referred pain down your leg or just struggling with lower back pain, come in and see us, we'll help you out. Thank you. Good stuff to us.
Oh, that's bloody awesome.
Oh, few good spots in there.
Good, mate.
Yeah?
Good show.
You ripper.
Yep.
There we go, first lower back treatment. It's only taken me 7 years.
Yep. You're
Finally
here.
done one.
Yep.
There we go.
Best in the business,
Best
Jace.
in the business.
Yeah.
Thank you.
That was bloody awesome.
A couple of red marks on here if you can see them. Come in and zoom in. So that's good. That's showing that there's blood coming to that area. So we're creating flow. That's what our treatment's all about.
Yeah.
Not going to give you too much away in there, but yeah, stagnation and flow.
That's
Is
it.
the trick. Thanks, fellas.
Done.
Done.
Fuck, that was awesome. I needed that. Do you want to give me a big thoracic crack, Jay?
Yeah, maybe. Are you going to film this? Still going, we're still rolling.
Still got some room on
here.
here.
Bonus. Hopefully I can do one. It'll be a bit of a letdown. Big breath in, Das. And out. Oh, did you get that one?
Yeah.
I reckon there might be another one up here, so we'll get some tension. Oh, nah, just the one. Just the one.
It's all good.
All good. Fixed.